Welcome to Second Time Lucky. I'm Nicole.
And I'm Mahi.
And we will be your hosts. Throughout this podcast, we will discuss transplants, the process of organ donation, and the ins and outs of my personal heart transplant experience.
Just a heads up, some of the content might be a bit triggering. While we aim to keep things quite fun, mortality and medical procedures are discussed throughout the series. Also, a coarse language warning because we have a tendency to swear like sailors. Sorry!
We would also like to say that we are not medical professionals, so please do not seek any medical guidance from the Second Time Lucky podcast. But we do encourage a transplant dialogue.
We hope you enjoy listening to it as much as we enjoyed making it. Episode 5, The Transplant Part 1, featuring special guest Nicole's mum, Maria.
Hello, and welcome to another episode of
Second Time Lucky!
I'm Mahi.
And I'm Nicole. And today we have a special guest with us. It is my mum.
Hello.
Her name is Maria. And we thought for this episode we would bring her in just because obviously my memory is a bit hazy and I don't know what happened during my transplant because I was unconscious. So we thought we'd bring my mum in because she's the one that was there 24 hours a day and she's the one that can tell it best.
She sure can.
So yeah, alright, so we ended last time saying that I got the call, it felt right, we were flown to Sydney. Mum, take it away.
Okay, so we arrived approximately around 11:30 p.m.
Yeah.
We were told to catch the taxi to the emergency of St. Vincent's Hospital. So we did that. We got there. The nurses were waiting for us and then it all started. So they took us up to the ward. We were there to about 4 a.m. They came in, you signed some papers, prepped you up and got you ready to take you into theatre around 7 a.m.
Yeah, so this was essentially like last time where like I had to have a shower.
Correct.
Do all of the, what's it called? Like the antibacterial wash. I took medication
for it.
So they're immunosuppressants that you take pre-transplant just to avoid infection and stuff like that. Yeah, okay. So I was taken in at 7.
So did it take that long to do the prep? Like 11, well I guess by the time you got there would it be like midnight-ish or was there a bit of waiting as well?
The waiting is they're bringing the heart in as well. So you've got to remember the heart was not in Sydney. So when we got the phone call, the heart actually came from Brisbane.
Oh, so that it's not. So okay. So they determine in Brisbane whether it's
correct.
A match.
Correct.
So they determine if it's a match, but then you don't know that it's viable until they bring it to Sydney and essentially take it out and test it. So that's what happened with my second time.
Yeah. Because
like I said in the earlier episode, I was taken in and then like last minute I was wheeled in and they were kind of like, this isn't going to happen. So that's obviously what happened. In that time, they were testing that heart and obviously realised it's just not healthy enough for transplant. So this time, obviously
it was. So they tested the heart, everything seemed to be okay, and that's when the nurse walked in and said, perfect, we are taking Nicole now. And that was around 7 a.m. So Con and I, her dad, kissed her goodbye and left her alone with Matt, obviously. And then Matt came out of the room and said they've taken her in.
So how was I?
So you were actually very calm. I think we were all waiting for this now. And I think we were all calm. I was a little bit nervous. But hey... your dad was a wreck.
Shocker.
And Matt was pacing. So, yeah, it was a traumatic time. Also, we had your two sisters back in Adelaide calling all the time, asking a lot of questions that we couldn't actually answer. So, you were in theatre from 7 a.m. to 7 p.m. No one, I think one person came out halfway through and said everything is going well, but it's taking longer than usual.
Did they say before the transplant how long a transplant takes, or were you like, this is normal amount of time?
No. So they said between 4 to 5 hours, So after the 5 hour, that's when I started to panic. There was a phone that you could ring into the theatre and someone would answer and obviously give you information.
That's actually quite cool. I didn't
So
know that.
So we phoned a few times. Well, I phoned a few times, but the answer was always the same. Still under theatre, we'll let you know.
Yeah.
So the information wasn't very informative.
I mean, in their defence, they're working.
Correct. Correct.
But
So
how many hours had it been before the first time you heard it was going to take longer than expected?
I think after the 6th hour.
Oh wow.
Yeah.
Okay.
A nurse came out and she just said to me, everything's going okay. It's taking longer than what we expected. She's fine. That was it. And then I think around the 10th hour, a doctor came out and said, we had a few complications. The heart is a little bit too big for Nicole, and we have left her open. And she was on full echo by then. And
so echo is life support?
It's like life support.
It's called ECMO.
ECMO.
So it's essentially just I'll get it up so that we can actually say. So it's actually called extracorporeal membrane oxygenation.
So it's
essentially a machine similar to a heart-lung bypass machine used in open heart surgery. It pumps and oxygenates a patient's blood outside of the body, allowing the heart and lungs to rest. So obviously my body needed.
It did. So they wanted to keep her like that we thought initially it was going to take 5 days. So this was on the Monday, and by Wednesday they said we are going to close her up.
Do you mind if I just go back to the heart being too big? Mm-hmm. I mean, what's the solution for that? Like, sure, if it's too big, it's not the right
when
heart,
they
right?
said to me it was too big, I obviously straight away thought it's a male heart, not so much a female heart. And that was my initial reaction to that. And that's what we said, why would you put a heart that's too big? But what happens is when you let it rest, it actually falls into its right.
So because the heart was essentially stressed, I guess from like
coming out of the other body.
It's also like the trauma of its original, person passing away. I guess that in itself would be traumatic for your organs. Then having it taken out, then having it tested. I think it was just a bit inflamed.
Exactly right. And
because they do test your, like, part of the workup, I remember for me, was they like measured me and stuff to see how big my cavity was, because to avoid this.
100%. That's why it triggered that question.
Yeah. So obviously, they do know roughly what kind of size heart will fit in whoever, like the recipient. But because this heart was obviously went through a lot of trauma within such a short amount of time, I think, would have eventually relaxed.
It did.
And went back to its regular size.
And they were thinking it was going to take more than a few days, up to 5 or 6 days, but it only took 2 days. So that was good.
Oh, okay.
So by Wednesday, they had put her back into theatre and closed her off. Which again, then you're thinking of infections and things like that, because she's gone back into theatre again. So that was another complication there with her kidneys not functioning properly.
So I was in, what was going on with my kidneys exactly?
Okay, so your kidneys were not functioning at all on their own. So we had to put you on a pump for your kidneys.
Dialysis.
Correct. So you were on the dialysis for your kidneys, and there were pumps. I don't know what they're called actually, but there were things going in and out. Not really sure.
Is that dialysis?
Not the dialysis. There was another machine there as well that was pumping your blood and everything going through your body.
Mm-hmm.
So you virtually weren't using any of your organs on your own.
So my body was well and truly just resting.
It was. So they were getting a little bit concerned because we're Wednesday now, so by Friday you're still not waking up. And they were a little bit concerned, so they gave you some drugs to reverse the induced coma.
Yeah.
Thinking that this is going to help, but again, you were in not waking. So everybody was a little bit concerned. So by Friday afternoon,
So I was lazy.
You were very lazy.
In a coma.
Yes, you were. You wouldn't even wake up, Nicole. So they took you down for a brain scan, thinking something happened there. So that was another stressful time waiting for that as well.
Just
again,
keeping
your
you on
dad.
your toes.
Yeah, you were actually, because again, your dad had disappeared because he couldn't cope, and Matt went for a walk because he couldn't cope, and then I'm sitting there on my own waiting for these results, and they came back and they were positive, like everything was fine.
Yeah.
By Saturday you had a little bit of movement, and by Sunday you actually opened your eyes, which was excellent.
Was that like so open eyes and now you're awake, or was it just open eyes and then went back to sleep?
She was very drowsy. She was not open eyes and go, hey, I'm ready to party.
Yeah.
She opens her eyes.
I'm still not ready to party.
So she opens her eyes and she recognized all of us. Like I would ask questions and she'll just nod, because obviously she had a tube down her throat, a breathing tube, so she couldn't actually talk. But she would nod if I say to her, do you know where you are and do you know what happened and things like that.
I was just going to say, did I know what had happened?
Yes, you did, which was surprisingly.
Oh, actually, Maria, since you're here, you're absolutely the person to ask this for. So is this the third time Nicole was in a coma, or?
So the first time was in her cardiac arrest, the very first time, and she was in an induced coma again for I think 4 days, I think it was, and Nicole had lost a lot of the short-term memory, so she can't remember 2 weeks of that.
Yeah.
So I think that was the only time. That was the first time, and then the second time is obviously with the transplant.
Oh, okay. And in both occasions, did she always know who
yes,
everybody was?
which is funny because even the first time when she woke up, the doctors were really concerned because obviously we didn't know how much oxygen she had. Didn't go to her brain the first time, so they were thinking brain damage and things like that. But as you know, Nicole, she opened her eyes with a smile on her face. Cute. So I sort of knew from then, nah, she's fine. So again, I asked her, do you know who I am? And she nodded. And do you know where you are? And she sort of did. She didn't actually know where she was because obviously with the cardiac arrest. But yes, the tube came out, and then we were sort of talking to her and she was responding, and yeah, and then I realized that she had short-term memory loss, that I would walk out the room and then she wouldn't even remember that I was in there. And that went on for 2 weeks.
We'll probably have one of our other friends on at some stage, but I remember he took offense because he was there like every day, and you're like, you didn't come to visit me.
Correct.
Once.
Still sassy, like straight after like being in a coma, like still with attitude.
Yeah.
I'm so sorry. I mean, look, in my defense.
I can honestly say this time though, the short memory loss, there wasn't really any memory loss this time.
Yeah, I don't
feel like you remembered everything. But
even now thinking about it, obviously when I was under, I obviously don't remember. I remember parts of the day that I had my surgery. Like I remember like baking you the cake and like making soup day, and like. But I feel like I do have a pretty good considering everything that's happened. I feel like
this time, I feel like this time you've done really well. Like you woke up and you sort of recognized everyone and you knew what happened. And I remember when they took the tube out of your throat, a nurse had said to you, "Do you know why you're here, Nicole?" And you replied by saying, "I was given a special gift that I need to look after for the rest of my life."
Oh my god.
Yeah. And the nurse.
That's so profound.
Yeah. And the nurse had.
Who do I think I am?
Yeah. And it was amazing because the nurse goes, "Oh, this kid's amazing," and I said she is. But that was part of Nicole's personality, and then the real personality came out.
Movie, like God, nobody actually talks like that after an experience.
Maki, if my mum said that, then you'd stop questioning it, alright?
Her dad was there as well.
You guys had a meeting before this podcast recorded.
No. So yeah, that was very special.
Yeah.
That was very special.
Yeah. It's like from Touched by an Angel.
I just feel like I was a very proud mum that day.
Oh, bless.
Truly.
Not about the transplant, just that I said something nice.
Well, I felt like, hey,
yeah.
it was worth it because, you know, she's going to appreciate this now. But yeah, it was funny because then you would hallucinate, and that was even funnier.
Oh my god.
I've heard about the hallucinations. I want to hear about them every day through the rest of my life. Please, Maria, tell us what these hallucinations.
Sure. So Nicole woke up Sunday, So by Tuesday, the breathing tube came out of her throat. So by Wednesday, she could talk, and I always arrived at the hospital probably around 7 a.m. And I walked in, and she goes, "Mum, you need to tell these doctors and nurses off." And I said, "Oh my God, why? What have they done to you?" And she goes, "They party all night. They put a disco ball on that night, and then they turn off the lights, and they're having parties, and there's a bar, and they're drinking, and they're just so loud, and they have no consideration for us patients."
I actually remember like seeing like my room. So I used to share a room. There was like, I don't know, a few of us in a room, 4 in a room.
Yeah, it's a ward, so
Yeah,
you've
so
got.
and I remember like I can't even explain it, like a movie when like the room just turns into, it's like there's a button, like a huge red button, and you press the button, then like a wall appears and like a disco light would come down, and like all of these like booths were right in front of me. And it was funny because I could still see my legs because I was in my bed obviously, and I could still see, even like remembering now, I could remember seeing my legs like in my gown and like under the blanket and whatever. And then I would look around and see nurses that I recognized, that I would see during the day, and like my doctors, and like the ones that were really, even like the old ones that
the
were
ICU
like
doctors.
yeah, and I would see them like clink like with their drinks like oh my God, so happy to be out of work, like. And I was like, are you guys for real? Like, I'm trying to fucking recover from a huge surgery.
And also, like, they're in Sydney. There's so many bars and clubs like right up the road, but they're gonna build a disco ball into the hospital
when all of the
patients,
when they're all asleep, or when they think they're asleep.
And they got government funding to do this, obviously.
Yeah, well, I mean, obviously.
But she was very upset. She was.
I remember being
She was
pissed.
bad. She was very pissed, and it took me a while to calm her down and saying, "This is not happening, Nicole."
But I remember also, like, what was funny with you was you were never like, Nick, no. You were like, well, do something about it. Like, talk to someone.
Yeah.
And so I remember the next day, like an idiot, I stopped this nurse. She was like doing obviously like my obs and whatever, and I said to her like, while I've got you here, like, I'm so sorry. I don't want to like be annoying, but I just feel like we need to rest. And like, you guys, I understand it's hard and whatever, you have a hard job, but like, can you maybe go elsewhere and not drink and like party right in front of us? Like, we're tired. And she was like, what?
She was looking at me, and I just winked at her, and then I took her out, and I said to her, "Hey, she's just hallucinating." And the nurse goes, "It's fun. Let's play with it."
But legit, she was like, I'm so sorry. Like, you know what? I might tell the others, and maybe we can go elsewhere tonight. And I was like, that seriously, that would be so nice. Like,
so yeah, we had fun with that. We had fun with that.
Am I actually for real? As if I actually, and I would never, like, I don't have the balls to like.
Well, you did
confront people. Like,
actually, I feel like you grew balls over.
Oh, I did straight
operation.
after my transplant.
Yeah, I feel like things had changed. I mean, you were grabbing Matt every time you walked in front of the doctors and the nurses.
Oh my God.
And Con and I were embarrassed at one stage and said, "Oh my God, who's this child? Whose child is this girl? Oh my God!" But
were you just being like a hornbag in front of
I feel like she was.
I don't remember that. Like, I don't. Probably. I mean, I don't
I feel like her whole. Con and I got worried, thinking, "Oh my God, whose personality did she get from after the transplant?" But no, it was Nicole's. It was, yeah.
Just so everyone knows, let's settle down. Like, I'm not like.
No, she's not.
Oh.
Things did settle down. Things did change.
Yeah, I mean, I remember that wasn't a hallucination. I just remember like.
No, you were awake through that one.
Being weird. Yes. Yeah. But like like obviously the bar thing was a hallucination, but I remember also laying in my bed, and because I had to lay flat.
Mm-hmm.
And I remember seeing like all of these red balloons everywhere, and they had like string attached to them. And I turned, because obviously I was in a lot of pain as well. So like I would turn my body and look, and they were attached to like tails of Dalmatian dogs.
Just like every Australian hospital.
Yeah.
Right? Yeah. I mean,
and
that's
she
just
would say, "There's thousands and thousands of dogs in here, Mum. Why are they letting him in ICU?"
Yeah, and I just remember thinking, and I remember like, I like, even thinking about it now, I remember the smell of it. Is that weird? I don't.
Yeah, it was funny because we
And-
made fun of you with that one.
And
as
I was
well.
like, all right, it's cute, but enough, Mum.
Yeah.
Get rid of him. Like, I'm over. I'm tired. I'm just trying to sleep because all I could see was balloons, and the balloons were like rubbing together, and like the dogs were loud, and I was like, oh my god, like get rid of
And she
them.
was really angry. She actually was angry, and she was screaming at me to get rid of these balloons. But I just thought I'm gonna play along with it. No point me just sitting here arguing with her.
How
because she
did
couldn't
I
believe
think
me.
that there were just a million dogs in my room?
So
like,
our doctors and nurses had fun with Nicole.
Yeah.
I must admit.
But what was your response to the balloon thing?
I just laughed. I said to Nicole, we needed to make you happy. This is making you happy.
wow.
Yeah, so we played along with it.
It's funny though, because I remember those things like a memory, not like, oh, that was a weird dream that I had ages ago. That was like, I remember them like I remember all the other things that we're talking
Well, the
about.
fact that you can identify the smell is
Yeah.
really interesting.
I think with all the
Yeah.
drugs that Nicole was on, and because they put her under twice, you got to remember in 1 week as well. So the drugs were very powerful things. So
I mean, hallucinations are very, very common with
Yeah.
like
after
a big
operation
surgery like this. And all of my, I mean, literally every single one of my transplant friends has a story about their hallucinations, which like we will get into further detail when they're on.
Yeah. Is it a specific drug that causes them, or is it like the combination,
I
or is it
don't-
like
I'm
a
not
combination of the
sure.
drugs and just the experience?
I
Okay.
have no idea. I don't think
I
we
don't
ever
know.
discussed it with the doctor. I think it was just a very common thing to happen. But
Yeah.
I feel like she was on morphine for pain as well, and then with all the other drugs that they had given her and the anesthetic, maybe, but God knows.
Yeah, I don't know. I feel like
We
I never
didn't
really
discuss it. We actually didn't discuss it with the doctors. I think we played along with it, but we didn't actually ask why.
no.
So
And I still have never actually brought that
No.
up ever to a doctor just to actually get a bit of closure and know why that
yeah,
happened.
I think we sort of let it go once you came out of ICU because that didn't happen again after that.
Well, there was a lot. Like, I remember having, like, reoccurring dreams
Yeah.
and, like, things sometimes were a bit scary or, like...
And you could tell the difference between hallucinations and dreams?
I remember the dreams. It's very hard to explain because, like I said, the hallucinations to me now feel like they were a memory.
Yeah.
So, like, even back then they did too. Whereas the dreams, I can, like, differentiate those.
Interesting.
But I remember I had the same dream for, like, 5 nights in a row. And it was scary. It wasn't, like, you know, like, crazy or anything. But I still do remember that. And, like... It is weird, but like I said, a lot of transplant patients did have the same experience, so I know that it's not.
I feel like a lot of people, not just transplant, is through operations. And
Yeah,
I think it's
yeah,
through
I
the
think
drugs
just,
and everything.
A lot of medication.
Yeah, with the medication plays havoc on your brain. Who knows?
Yeah.
But it
But-
was interesting.
Yeah.
It was very interesting.
Yeah. I would have loved to have been there, like, as
Oh, you
your-
would have enjoyed it. I feel like for me, it made me feel a little bit the stress of everything let go a little bit.
Yeah, like something funny
Like
was happening.
something
so,
funny
like-
was happening
Yeah.
as well, so you're not just focusing on the worst part of the transplant as well.
Mm.
So yeah, I mean, yeah, we had to cope with that as well.
Yeah. But I mean, that eventually subsided.
It did.
So how long did that last? So like, was that was in the ward? Because I remember
So
that
that
being
was in
the
the
ward.
ICU. No, that was in the ICU. So you were there until Sunday. I think Monday we moved you into a room on your own.
Yeah.
And by this
Again.
stage you've been in hospital for a week?
So now she's been in the hospital for a week. So you were in another room on your own. Again, it's in the ICU unit, but it's a room on your own with sun as
Yeah.
well. And that's when you were learning to sit up
Yeah.
as well. So you were still having a few days where you would hallucinate or have some dreams, but that was subsiding slowly.
Yeah.
What do you mean by learning to sit up?
Because she was laying flat for so long and muscle, it just deteriorates. So she had to learn how to walk again and how to sit
Wow.
up. So yeah, that was another dilemma because Nicole, luckily we had Matt there. So Matt would actually lift her up and put her in a chair
I'm just shocked that your body muscle can deteriorate
Yeah.
so much after
Yeah.
just 1 week of being in bed.
It was 10
It's
days.
also like not
It
even.
was about 10 days.
I mean, like even when you're in bed, say like now, when you lay in bed for a week, if you're sick and you're watching TV the whole time, you're still like getting up and going to the toilet, or you're still like changing position. Whereas when you're in hospital, you're literally not moving a muscle. Like you're not
Especially
doing
with Nicole,
nothing.
because you got to remember she was in an induced coma for so many days, and then they had to put her again into under anesthetic again to operate and close her up. So that was another operation just there again. So she did not move a muscle for literally, I think, 10 days. So by the time she did wake up and everything, there was no muscle. So we had to learn how to. So the physio will come in and move her legs around and her arms and teach her how to sit up. That was the first thing, and then we slowly got her up, and she had to learn how to walk again. So we have a video of her learning how to walk.
I just remember that being like the hardest thing in the whole entire world. I remember like physio would come when I went to a ward. They'd be like, alright, I'm here to do physio. I was like, no, I don't want to do physio. And they'd be like, all you have to do is literally just get up off your bed. That is your physio today. That sounds so easy now, knowing obviously that we're all fit and able to do that. But literally like turning, having to put my legs over. Because
But you got to remember, you couldn't move your chest at all.
So I also wasn't allowed to move my
yeah.
arms. So I wasn't allowed to use my arms
No.
for any stability. So
no, so her arms had to be crossed
I had
over her chest.
to literally cross my arms over my chest. They actually gave me a towel that they wrapped up with
So
like
she wouldn't
sticky
move 'em.
tape, and were like, you need to just hold this towel at all times. So I had to like get up. Literally, you just have to use your core for everything. Now I don't have a bloody core on the best of days. So like imagine after losing so much muscle, having to just turn your body and get up. So no one can lift. Like my mum couldn't like get my arms and help me help me do that. No one could help me. So like I couldn't even use my hands to move up on my bed or like do anything like that. So even if I was like sliding down on my bed, I was like, Mum, you need to like pull me back up because I can't use my arms. I couldn't wiggle. Like I couldn't do anything.
Now, could you not use your arms because of the like deteriorated muscle mass, or was it because it was just
the operation?
Oh, okay, it was just gonna put too much strain on your chest.
Yeah, so it was because of my sternum, like my wound essentially.
Yeah.
So they say not to. What was it? I think it was like a month to not put any pressure on my arm.
Were the first 2 weeks were the crucial time.
Yeah.
And then gradually we were using the arms, because I remember lifting her and she would put her arms over me and put all her weight onto me so I can lift her and take her to the toilet and shower her.
But in regards to me actually using them to get up for stability, or even like I couldn't like hold a handrail or something because they were like, you're putting too much pressure on them. I was like, what? So like I remember I was in hospital for 1 month total, and I didn't use my arms for anything essentially, like except for like feeding myself and like.
I don't even think you did that.
Well,
I mean, I fed you for the first 4 weeks.
Even the first 4 weeks, Mum was just because of my tremors. But we'll obviously get into that in a second. But so I remember even like being discharged, and they were like, you can't hold something heavier than what was it, like
I think
kilo when I was discharged?
Not even a kilo. It was ridiculous. I think like your water bottle.
Yeah, so Mum was like, Nick, can you just pass the milk? I was like, oh yeah. Mum was like, hang on, no, you can't pass the milk. Don't touch it. I'm like, oh, I don't know.
Wow. It was really hard in the beginning.
You don't realise how much you pick up.
I feel like showering Nicole, because I was showering Nicole from the hospital.
Yeah.
So I was doing everything from the hospital to learn to do this stuff when I took her with me into the unit.
Yeah.
Because it was only going to be Nicole and myself.
Yeah.
So
you guys had accommodation in Sydney for your recovery.
Yep. So what they do is they have like hospital accommodation. So someone who is, because St. Vincent's is like a transplant hospital, but they also do like chemotherapy there and stuff like that. And people come from all over to do that kind of stuff. So families and recipients of transplants stay there, or like people who are going through chemo or their families, whoever's going to be there for a couple of days, they have access to this accommodation, which costs money, but barely, not much.
And it's
I think
just
it was
handy.
like $30 per person or something.
Yeah, but I feel like it was handy for me because it was walking distance to the hospital.
Yes.
It's directly behind the hospital, literally a
And
5-minute walk.
Exactly.
When you're fit and able.
Yeah, exactly right.
And
because we discharged Nicole after 4 weeks.
Yeah, a month exactly.
After the hospital, because she had to learn what medication she had to take, so she had to learn that on her own. So there was a lot of medication that she had to learn, so she had to learn that. Then we had to learn how to walk. We did physio. Once she did physio and she could actually walk a little bit, we were allowed to go home.
So they discharged me from the hospital when I was able to go up 2 steps.
That's correct. Yes.
Wow.
Yeah. So I was every day, I did physio twice a day towards like when I was a little bit better. So I would say like the last 2 weeks of me being admitted, I was doing physio probably twice a day. If my physio forgot, it was like the best day of my life. Because it would honestly just exhaust me.
Yeah.
So they would take me for a walk like around the hospital ward. When I say that, like 200 meters max, that area was.
Wow.
Yeah. And so I would walk around, then come back. They might make me do like 3 squats. When I say squat, I don't mean like a gym squat. I mean like literally just bend your leg 2 centimeters and see what you can do. And I remember they gave me like these little what are they? What are they called? Those little like steps that you see at the gym. They're like this big, and they had them in front of my bed. And she was like, "Can you step on that step?"
The stepping things.
Yeah.
Yeah.
And she would be like, "All right, step on that, and then put your leg backwards and step down. Step on that, put your leg backwards and step down." And when I could do that, they said to me, we don't feel comfortable discharging people unless you can step up a real step. And so there was like a fire escape near my room, and so the physio would take me. I remember Matt came a few times because he was very like, "You got this," like, and I needed him in case I fell down the stairs. So, and the physio literally said, if you can do 2 steps, I'll discharge you, and you don't need to go to. There was like like an external rehab.
Yes.
Where sometimes if you're not like
if you haven't done your proper physio,
if they don't feel like you're
good enough to be discharged, they send you. It's across the road from the hospital.
Yeah, and it's
basically
it's a rehab center.
And it's a rehab center,
so
she would have had to do that while she was discharged.
If you're medically okay and don't need the hospital anymore, but you're not physically where you should be, they'll take you to a rehab center. And I said to Mum, I'd rather die than go there.
And because she would have had to stay there on her own.
Oh.
Yes, and that
Why couldn't you be there with her?
No, because it's a rehab center.
So it's like you get up, they do physio with you all day.
I could visit.
Take you to the gym.
Oh.
Like, it just to me sounded
even
like
at
hell.
your best health, like
yeah,
when we're
that
in school,
is my worst nightmare.
Yeah.
Legit. So I was like, Matt, because my mum was so lenient with me. Like, she was honestly so lenient. Like, Mum would be like, did you want to go for a walk? I'm like, nah, fuck that. She was like, all right, cool. Or like, if Matt was like, come on, Nick, let's go for a walk. I'd be like, nah, Seebs. And he'd be like, get up. We're going to go for a walk. And then, like, you can have a chocolate when you come back. I was like, all right, I'm coming. Let me get my shoes. Like, so, like, Mum was very lenient. And so, like, when Matt was there, I used it really to my advantage to be like, you need to push me. I'm going to scream at you and I'm going to call you names. But this is how I'm going to get discharged without having to go to rehab.
Were you comfortable with that? Like the idea of just 2 steps was enough for rehab, or were you kind of like, oh, I would feel more comfortable if I could stay?
I knew that I didn't want to go to the rehab center.
Yeah.
I think also medically, I knew that I was okay to be discharged, but I wasn't ready to be discharged.
I feel like both of us weren't ready.
Yeah.
Because she was supposed to be discharged on the Friday, and we said, can we just leave it until Monday? And then we said Tuesday, and then they go, enough. She needs to go home.
Well, it was funny because every time a doctor would come, my first question would be like, when can I go? Please, let me discharge. Let me go. And then one day I remember, like, again, in the morning, I was like, can I go? And they were like, actually,
You
yeah.
can go tomorrow.
And I looked at Mum and I was like, I don't want to go. I think it just hit me that, like, I wasn't going to have, like, 24-hour surveillance. Like, I also don't have my defibrillator anymore.
I think that was the biggest thing.
Yeah, so I did not have any, like, security anymore. If something was to happen to my heart, that's it. Like, I've already survived 2 cardiac arrests. I don't think I'm lucky enough to survive 3. Like, in my mind, I was like, what if something does happen? And, like, Mum's in the shower, or, like, we're not home where, like, Matt's there and my dad's always there and my sisters are there and there's family 24/7. It's just me and my mum now. So, like, what if something happens?
And I guess because, like, previously, before your transplant, whenever you'd gone to the hospital, it was to be monitored, but you weren't ever getting any answers. So you were kind of already in this habit of just being like, all right, you saw me, let me just go. But this is the first time that something was actually coming.
But also we had the defibrillator
I also
as a
did
backup.
have the defib.
So I feel like that was a bonus.
Well, I mean, in saying that, the defibrillator
didn't work. Yeah.
not work one of the times. That once was enough.
It was.
To traumatize me.
This time I felt like I was in the same boat as Nicole. Do I know what to do if something happened? Even though I did know what to do the first time.
Yeah, and I mean, it's not that I doubted your ability. I just was like...
Well, I think I doubted my ability.
I'm scared to, like... It's also, like, you have to remember, when you're in hospital, I had, like, a Holter monitor on 24/7. The only time I didn't wear that was when I was in the shower, and I was in the shower for 5 minutes. What do you mean by a
Holter monitor?
So a Holter monitor is essentially like an ECG machine, which is where, like, all the stickers. So your heart rate
is hooked on
to the nurse's station.
Oh.
So whenever, like, in the middle of the night, if something would happen, or, like, if my heart rate went really high or really low, a nurse would just, like, casually come in and be like, you feeling good? Something was a bit funny on your monitor, but I can see you're fine, cool. I'll be like, yep, sweet.
How often would that happen?
So after transplant, it actually takes a long time for your heart to kind of, like, become accustomed to your body. So I remember when I first came out, my heart rate was very high, and they were actually quite worried, and they spoke about putting a pacemaker in.
And I said no.
After your transplant?
Yeah, so that's actually not that uncommon. A friend of mine had that done to her, but I really didn't want one, and I said to them, no, I'm not. I said, please, I know my body, I feel like my body will be fine, like, just give it time. And they're like, alright, but, like, if it doesn't, we're gonna have to maybe potentially put a pacemaker in. And I was like, okay, alright. And I said to Mum, like, nah, I'm not letting them do that. I'm simply not doing that.
Yeah.
And I remember, because my heart rate was like 120 just when I was sitting down. And like I said, with the Holter monitor, there's a TV and you can see your thing.
Yeah.
So it wasn't really, like, out of sight, out of mind, because I was staring at it. And I was like, oh, Mum, like, my heart rate is still 120. Like, what is wrong with me?
What's normal for heart rate?
I mean, between, like, 60 and
to 80.
Is,
whoa.
Yeah.
Whoa, okay.
Yeah.
Wow, that's a massive difference.
Yeah, so, like, that's like exercise rate. When I'm just sitting here doing that, I can't walk, let alone exercise.
Yeah.
So, like, they said, like, this is a possibility. We're not saying we're going to do it, but if things don't subside, we're going to have to do it. And I was just I'm traumatized by my pacemaker and my defib, so no, like, I'm not doing it. But then the opposite happened, and my heart rate went very slow. So I remember when I would sleep, doctors would rush in and be like, are you okay? And they'd bring, like, an ECG machine.
Whoa.
And, like, you know, like, do all the tests, and I'm like, I'm fine, what's going on? And they'd be like, your heart rate went to 40.
Oh my god.
And I'm like, what? The other day it was 120 when I was just bloody watching TV. And so, yeah, it did take a really long time for it to kind of just be normal. Touch wood now.
Were you watching Grey's Anatomy? Is that why it was 120?
No, I don't think so. I also remember, like, the one of the the speech pathologist came in after I had my tube taken out, and she was like, you're talking too much. And because I was always on the phone. I mean, when Matt was there especially, I just would not shut up.
Yeah.
Obviously with my mum and my dad, I was just, like, excited to be alive. So I was just like...
Yeah, she didn't shut up.
I really did not shut up. And so they were like, maybe you're talking so much and you're getting very like excited. Maybe that's why your heart rate is going up. And I remember she came in and she was like, you need to stop talking. For medical reasons, just shut up. And I was like, oh my gosh. So yeah, I mean it did subside. And I did shush for however
a day
long that lasted.
For a day.
Yeah, so I mean, but yeah, so like I'm very lucky that I got to avoid that because, like I said, a friend of mine did end up getting a pacemaker, and a pacemaker is not the end of the world either. Like, it's just when you come out of surgery and you just get rid of your pacemaker and defibrillator, the last thing you want is to have another procedure to have one put in.
And
like,
your friend that was the pacemaker, did they have a defibrillator before their transplant?
Yeah.
Oh, okay.
So she also had a defibrillator. I don't think hers shocked her much. I remember hers was she had one that was faulty. And so hers used to shock her, not all the time, but when it did shock her, it wasn't like warranted. So like at least mine, I knew that my heart was in a bad rhythm and it was doing what it needed to do. Whereas it was worse for her because she would just be like walking down the street feeling fine and she'd get shocked. So she was just as traumatized as I was. And even now when I speak to her, she's like, oh, you know, she doesn't have a defibrillator now. So a pacemaker and a defibrillator are different.
Because a pacemaker doesn't shock you, it just
it just paces
Yep,
the
that's
heart.
Right. So she's like, as long as I don't have a defib, I don't really give a shit.
Okay.
Like, I'm happy to have a pacemaker. But I was just very against it. And obviously, if the doctor said that it was absolutely necessary, I would have done it. But like, I don't want one.
Yeah.
So, yeah. But I think that's also why we were very hesitant to be discharged, because I was like, I don't have any backup. Like, I've got nothing.
I think it's from coming from Adelaide with a defibrillator and what dilemmas we were going through, and then having the transplant, and then all of a sudden after 4 weeks ago, okay, now you can go. Thinking, hang on a minute, what am I doing? Because I'm just going to be left alone with Nicole.
Yeah.
But by saying that, where we were staying, you can just call the hospital and a doctor would come straight away because it's only walking distance. So that was handy to know. And they did make us feel a little bit more comfortable when they did mention that. So that was good.
Yeah.
But when you got discharged, you were still going to the hospital quite frequently.
Every day.
Every single day.
Okay.
Every day.
Legit every single day.
Yeah.
I feel like at first that was kind of comforting for both of us.
And then it just got annoying.
And then I was like, I'm fine, I'm ready to go home. Like, enough. So I had like, I don't remember the days, but I think it was like Monday, Wednesday were like bloods, x-rays, doctor visits, and then Tuesdays and
biopsies.
Thursdays.
So we had biopsies on Mondays with bloods.
Yeah.
And hospital, like, what do they call
Triage.
it? Triage. So the doctor visits.
Yeah.
And then we had physio. And then we also both had to see, well, you had to see the psychiatrist.
Yeah.
And I had to wait outside. And then we both had to do seminars. So what they do, because they think it's not only the physical side of things, it's the mental side of things. And so the carer plus the patient need to do a seminar where you all sit in a room and they talk to you about how are you coping through this ordeal. So the carer, so most carers, so there was I think about 10 other people in that room.
Yeah, there was like 10 like couples of people. So like,
so their carer plus the patient.
Yeah.
And it could be a lung the majority were lung transplant.
They were all hearts and lungs, but majority was hearts.
So we were sitting there, Nicole and I, and to be honest, we never fought. If anything, we bonded a lot more. Yeah. And we had a good time.
No,
like we would joke and have fun. So the other carers would come in and say, when did this mood changes?
Do you want to kick your patient's ass? And I was like, Mum, do you want to kick my ass? And she was like, no. I was like, are you bullshitting? Like, I feel like everyone here is literally saying that they hate.
So they were hating their patient.
Or like their, so it was usually their partner.
Yeah.
So like, you know, sometimes the husband has to take care of the wife or vice versa. There was, I think, a daughter and a son and a mum. They as well were very pissed off at each other.
They were really bad. They weren't even talking to each other. And then Nicole and I just sat there listening to it, and I'm thinking, oh, I feel all right.
Well, I also kind of felt like shit, because I was like, am I putting this on my mum? Like, I didn't think I was that bad.
To be continued in the transplant part 2.